It's a question that so many parents ask themselves. You watch your child just bursting with this endless energy, running and climbing, and you can't help but wonder, is this just normal kid stuff, or could it be something more?
Hey there, and welcome. In this explainer, we're going to dive deep into that very question, exploring the sometimes blurry line between a typically active kid and a child who might have attention deficit hyperactivity disorder, or ADHD. The goal here is really just to give you some clarity and help you feel more confident in understanding your child.
All right, so here's our roadmap. First, we're going to tackle that big question. What's the actual difference between being active and being hyperactive? Then we'll get a really clear picture of what ADHD is. After that, we'll learn how to recognize the key signs, figure out when it might be time to chat with a doctor, and most importantly, we'll wrap up with some practical things you can do to support your child.
Okay, first things first, let's get right to the heart of all the confusion. It is so easy to see a kid with all that energy and jump to conclusions. But as you're about to see, the real difference is in the details, not just how much they're moving around.
Okay, so this slide is super helpful, right? Let's break it down. An active child can usually settle down for a story or a quiet activity for a little while. But for a child with ADHD, being forced to sit still can feel physically uncomfortable, almost painful. And here's a big one: context. An active kid might be wild at home, but pretty calm at the library. With ADHD, that high energy is there pretty much all the time, no matter the situation. So you see, it really comes down to context and consistency. That's the key takeaway.
So if it's not just being a busy kid, then what exactly is it? And this might be the biggest mindset shift we need to make. ADHD is not a character flaw. It's not a failure in parenting. It is a real, recognized medical condition.
So what does a term like neurodevelopmental disorder actually mean? Well, think of it this way. This isn't about having a few off days. The words to really focus on here are persistent, frequent, and severe. The behaviors are ongoing, and they create real, significant challenges for a child, at school, at home, and in their social life.
Wow, okay, now this is really interesting. Take a look at this chart. Boys are diagnosed with ADHD up to 3 times more often than girls. Scientists are still trying to figure out exactly why that is, but it's a consistent pattern that doctors have seen for a long time. So when it comes to the exact cause, we don't have one single answer. But researchers have identified several things that can increase the risk. Genetics, for example, plays a huge role. ADD often runs in families. Other factors can be related to brain chemistry, injuries, or even certain conditions during pregnancy. But it's super important to remember, these are just risk factors, not guarantees. So what should you actually be looking for day to day? Well, the signs of ADHD are usually broken down into 3 main groups. Let's dive into those right now.
First up, let's talk about inattention. And please remember, this isn't about being lazy. It is a genuine struggle to maintain focus. This is the child who makes those silly, careless mistakes on homework, who seems like they're in another world when you're talking right to them. Or, and I bet this sounds familiar to a lot of parents, right? The kid who leaves a trail of lost sweaters, lunchboxes, and toys wherever they go.
Next, we have hyperactivity and impulsivity. These are often the signs that people notice first because they're so visible. We're talking about a child who seems to be constantly on the go, like they're powered by a motor that just won't quit. They're always fidgeting, squirming, climbing. And that impulsivity part? Oh yeah, that's why they might blurt out answers in class, interrupt conversations constantly, and find waiting their turn to be almost physically impossible.
And the challenges don't just stop with those core symptoms. ADHD can also make it incredibly hard to regulate emotions. This can lead to these really big, overwhelming feelings of anger or frustration that seem to come out of nowhere. You might also notice struggles with organizing their thoughts to speak clearly, or epic battles at bedtime because their brain just won't switch off. I mean, you can just imagine how all of this adds up and makes something like making friends feel almost impossible.
Okay, so if some of this is starting to sound familiar, what's the next step? Look, the single most important thing is, please don't try to diagnose this yourself. This is where you absolutely need to bring in a professional.
And when you do see a doctor, they have a really specific set of criteria. They're looking for a clear pattern, at least 6 distinct symptoms that have been going on for more than 6 months, and this is a big one, the behaviors have to be causing real issues in at least 2 different places, like at home and at school. This helps them rule out if it's just, a problem with one specific teacher or situation.
And really, this is the whole point, isn't it? Getting help early isn't about putting a label on a child. It's all about getting them the right tools and support so they can succeed, feel good about who they are, and thrive.
Okay, this brings us to what might be the most important part of our whole conversation. Because as a parent, you are your child's #1 champion. So let's talk about what you can actually do.
I love this list because it's full of things you can start doing like today. First, structure is your best friend. Consistent routines for meals, homework, bedtime, it's a total game changer. When you give instructions, keep them short and simple. And then, you gotta celebrate the small wins. Praise them for every little bit of progress. Finding a healthy outlet for all that energy is also key. Sports, martial arts, anything that builds discipline. And that last one, communicating with the school, that's absolutely non-negotiable. You and the teachers have to be on the same team. Period.
Now, when it comes to professional help, there's no one-size-fits-all solution. It's usually a team approach. This can include therapies to help your child build new skills, and educational programs for you, the parents, to give you more tools for your toolbox. And sometimes, a specialist might decide that medication is a helpful piece of the puzzle to manage those core symptoms.
And finally, how we talk to our kids makes all the difference in the world. The goal is this blend of being patient and gentle, but also firm and consistent. This one here is huge. Never, ever criticize or scold them in front of other people. It can be so incredibly damaging to their self-esteem. And always, always keep your promises. That's how you build that foundation of trust that is just so important.
So let's leave you with this final thought. Many people with ADHD are also incredibly creative, passionate, out-of-the-box thinkers with boundless energy. The real challenge for us is to shift our focus. Instead of just trying to fix what we see as flaws, how can we help these amazing kids learn to harness that unique energy and not just get by, but truly thrive?
Health is the most precious gift. If this video helped you or someone you love, please like, subscribe, and share, so more families can stay safe and healthy.